Let's continue with treatment principles, root, and manifestation. The principles of treatment can be discussed from 3 points of view: the root or pen and the manifestation, piao, when to tonify the upright qi or zheng qi, and when to eliminate pathogenic factors, the question of when to tonify and when to reduce. We shall discuss points 2 and 3 together as they are concerned with the same basic issue, so that the discussion will be under the following: the root and the manifestation. We treat the root only, treat both the root and the manifestation, treat the manifestation first and the root later, then the multiple roots and manifestations. Multiple roots, each giving rise to different manifestations, one root giving rise to different manifestations. The root coincides with the manifestation. When to tonify upright qi or chen qi, when to expel pathogenic factors. Tonify upright qi, expel pathogenic factors. Tonify upright qi and expel pathogenic factors. First, tonify upright qi, then expel pathogenic factors. First, expel pathogenic factors, then tonify upright qi. Tonify upright qi and expel pathogenic factors simultaneously. The root is called pen in Chinese, which literally means root, and the manifestation is called piao, which literally means outward sign or manifestation. That is the outward manifestation of some inner unseen root. The root and manifestation can be compared to a tree, its root being the root and its branches the manifestation. So here is a very good illustration of the root and manifestation as a tree. Number one, from the point of view of upright qi or chen qi and pathogenic factors, the root is the upright qi and the manifestation is the pathogenic factors. Number two, from the point of view of pathology, the root is the root of the disease and manifestation is the clinical manifestations. Example, invasion of external wind is the root and its clinical manifestations, the manifestation. Three, from the point of view of patterns, the original pattern is the root and the one originating from it is the manifestation. For example, spleen chi deficiency leading to dampness. Four, from the point of view of onset of the disease, the root is the initial condition while the manifestation is the later condition. Five, from the point of view of duration of the disease, the root is a chronic disease while the manifestation is an acute disease. Thus, when treatment of root or manifestation is discussed, we need to be clear about the particular standpoint or context being considered. For example, to say that in a certain case, the root needs to be treated first could mean that the upright qi needs to be treated first, or that the root or cause of the disease needs treating, or that the chronic condition should be treated first. In clinical practice, however, root and manifestation are usually considered in the second and third contexts, that is, as root and clinical manifestations of the disease and as original and deriving pattern. So, invasion of wind cold, the root, this will give rise to the manifestations: aversion to cold, fever, occipital stiffness, sneezing, floating tight pulse. Root and manifestations as original and deriving patterns. So, dampness as originating from spleen chi deficiency. Two main meanings of root and manifestation. The root is the root of the condition, for example, wind cold, and the manifestation is the clinical manifestations: aversion to cold, fever, floating pulse, etc. The root of the condition is the original pattern, for example, spleen chi deficiency, and the manifestation is the deriving pattern, for example, dampness. Thank you for your attention.